there's been a lot of concern about the post and why the post, and I can't sell my patients a post. And what we have found, at least I have found with patients, and that we are changing devices from the DreamTap to the flexTAP. Very few people have even mentioned the post. Most of them like it as a handle, can get it in and out easily. So the post in and of itself is not a problem. However, the mechanics and the science behind it is really the most important thing. If you look at any other appliance, the protrusive device is a compression device and pushing from the back, and the jaw joint always wants to flop open, and that's why they have to put rubber bands or some way to prevent the appliance from opening up. Otherwise it doesn't work. If you look at the research on someone like the Somnomed, it shows that that is a real problem. The unique thing about a post and the attachment point is that is it in front of the upper front teeth, attached to the front teeth, so there is no way that anytime that jaw moves either up or down, the jaw is coming forward. It cannot flop back, cannot flop open, which is the most critical point of any dental device for treating it. The other issue is when we designed it, is that with the Vertex technology is to align how the jaw moves when it moves forward. It has two movements really, the jaw joint. It has translation and rotation. Whenever we move the jaw straight forward, the jaw joint is coming down and translating down the eminence at a 45-degree angle. So that is a 1-for-1. So you move the jaw 10 millimeters forward, the jaw joint goes down 10 millimeters. And so to keep the path and plane of occlusion and the opening for the tongue the same and parallel, then that angle comes down. So if we move the jaw 10 millimeters forward, we need to move the jaw 10 millimeters down in the front to keep the path and plane of occlusion parallel. So there really is no rotation. The rotation issue is the real problem, and everybody says, oh, you're rotating. No, we're not rotating. There's no rotation, and it can't rotate by the way we have designed this.